Ticks are very sensitive to dryness. Their bodies desiccate easily, and in dry weather they hide deep in mossy crevices on the barks of trees, or in the leaf litter, or in wood rat nests. Damp weather, however, makes them more active, and they come out and stand around on the tips and branches and blades of grass by trails like hitchhikers at a freeway on-ramp.
Tally-ho, let the drag begin. Well, where we are now is a town in Cape Cod, and Cape Cod is considered to be endemic for Lyme disease. Oh, I'm good. This is a male deer tick that we picked up from the ground on our very first 30-second drag. This is a deer tick nymph. This is the second stage. They'll feed on a host for 5 days, maybe, and that's how Lyme disease is transmitted. It just doesn't seem possible that this poppy seed-sized thing is going to make you bedridden, possibly for the rest of your life. Now we're trying for a deer tick female. That'll complete the trinity. And here we are. The trinity is complete. There are 2 females. Let's call them Thelma and Louise. And they're on the hunt. Oh, there's another male. There's another nymph. We get another nymph. So our odds of getting Lyme disease here are going up. Despite years of education, the incidence of Lyme disease has been raised by 40% from last year. It's only going up.
Lyme disease is caused by bacteria, the Borrelia spirochete. It's spiral-shaped, so it can drill through tissue and get into just about any part of the body. The most common form of transmission is through the bite of several species of tick, commonly known as deer ticks.
There's bacteria inside the tick, so when it bites you, it just starts sucking up your blood, like Dracula would do. While it's like sucking in the blood, the bacteria will be released, and then it just gets into the blood, and it gets into your heart, and then your brain, and then you have Lyme disease.
It's possible that years ago the patients were only getting pure Lyme disease, and this might explain why the literature, there's such a disparity, where some people say, oh no, Lyme doesn't look like this. What we're now seeing is these ticks are containing multiple organisms. They're not just containing Borrelia burgdorferi, the organism that causes Lyme, but they're containing Ehrlichiosis, Babesia microti. It's a malaria-like organism. When you get Lyme and Ehrlichia and Babesia and Bartonella henselae, cat scratch fever, and Mycoplasma fermentans and viruses, the immune system gets overwhelmed. I'm not sure years ago all of these co-infections were present as they are now. Now the patients who are coming in to see me are multiply co-infected. They're much, much sicker, and it's because it's no longer just Lyme.
I didn't know what was happening to me. I thought I was going to die.
He kept saying to us, I have no idea what this is.
I've never seen this before. I've never heard of this before.
We don't know what's wrong with you.
Dark and not seeing any light of recovery.
What kind of a breakdown or series of breakdowns in the medical system can lead to a setting where you have an illness and people walking into their average doctor's offices may or may not be likely to get effective treatment for it? My case was sort of cut and dried. A, I was a park ranger. B, I knew exactly when I was bitten and I saved the tick and brought it to my doctor. C, I had a red rash. And D, I had a rather classic case of neurological Lyme disease with all the usual trimmings. But I brought all that to the doctors, and it took 5 doctors to figure it out.
I think you're sick. I don't think there's anything wrong with you. Everybody's telling you it's in your head. You know it's not in your head.
We don't think there's anything wrong with you.
There is nothing wrong.
We've done your labs. Your labs are fine.
I live on the west side of the northern Sierra Nevada in California. I was a park ranger for 21 years until I got Lyme disease and had to quit. It began with profound fatigue. Then I developed stabbing and shooting pains. I started having vision problems, blurred vision, and then came the memory loss and the cognitive problems. And once I drove to my office, a place I'd commuted to for 13 years, and stopped on the way home and called my wife on the cell phone and told her that I wasn't sure I could find my way home. I just wasn't in good enough shape to drive. Couldn't remember how to do it. If I hadn't had any kids, I might have killed myself. My life was so uncomfortable to be in that I don't know that I would have wanted to be here had I not had stronger family connections, you know.
Over the last 12 years, I've been diagnosed off and on with lupus,
Chronic fatigue syndrome, Crohn's disease,
Fibromyalgia.
Lupus, fibromyalgia, MS,
fibromyalgia, rheumatoid arthritis.
Doctors thought I had ADD.
Chronic fatigue syndrome.
Chronic fatigue syndrome.
Parkinson's disease.
syphilis, multiple sclerosis.
MS to ALS to nothing.
They were pulling anything out of their hat they could think of.
doctor after doctor after doctor after doctor after doctor, misdiagnosing her, putting her on some medication that didn't work, or just thought we were both nuts.
There's evidence that Lyme disease has been around for a long time, but here in the United States, it was the early 1970s when a Connecticut mom looked around her neighborhood and noticed something was not quite right.
Well, I was frightened, really, and doctors, were insinuating that it was all in my head. In the 70s, we were all having strange symptoms. Headaches and stiff neck and swollen joints. As I looked around the neighborhood, I realized that there were others that were having swollen knees and rashes. Finally, when our symptoms just weren't going away, I decided to call the state health department and report this mysterious disease that seemed to be coming to our area.
This is not a rare disease. It's thought of as a rare disease, but in fact, there's nothing controversial about the fact that it's the most common vector-borne disease in America today. It is far, far more common and much more dangerous to the average American than West Nile virus is. The Centers for Disease Control report over 20,000 new cases each year. Yet because the reporting rate is so low and the disease so often overlooked, they admit that the actual number may be over 200,000, making Lyme more prevalent than AIDS. Since 1991, the rate of cases has doubled, yet government agencies and the medical establishment seem to be downplaying the problem.
There are doctors out there who aren't looking for it.
He just kept saying, you don't have Lyme.
You don't have Lyme disease.
You don't have Lyme.
He told me there was no such thing as Lyme disease in North Carolina.
Lyme disease doesn't really exist in Tennessee.
You can't have Lyme disease because you haven't been to these areas in Long Island or this area in Connecticut.
I've been told it isn't Lyme hundreds and hundreds of times.
I have seen probably 30, maybe more doctors.
35 doctors.
About 15 doctors.
I've spent over $100,000 out of pocket.
$150,000.
$75,000 to $100,000.
I was misdiagnosed for 3 years.
5 years, 14 years.
15 years.
It's hundreds of thousands of dollars.
I'm guessing that my case, which could have been controlled with probably a single bottle of doxycycline, at the time I was bitten, probably would have cost something like $25 or $50 total, plus the doctor visit. As it is, I'm guessing that my case has now amounted to $75,000 to $100,000.
My concern is that the majority of the patients that I see here in this office, this very office, who come to me because they've been treated for chronic Lyme disease, is that they don't have any evidence of ever having had Lyme disease once. Ever. Not now, not a year ago, not 5 years ago. They didn't have the rash, they never had a positive blood test, they never had anything.
You see, class, my Lyme disease turned out to be psychosomatic.
Does that mean you're crazy? No, that means she was faking it.
No, actually, it was a little of both.
I was originally told at the very beginning that I had a very deep psychological problem.
People called me a hypochondriac.
They said I needed to see a psychiatrist.
You need to see a psychiatrist.
He told me, no, it's not Lyme. You don't have the rash. You are depressed.
You're faking it. You need to get mental help.
You're a teenager, get up and walk.
She doesn't want to go to school. She's just depressed.
You think you're crazy, but I'm not. I know I'm not crazy. This thing screws you up big time.
One of the hallmarks of the onset of untreated Lyme is a multi-system involvement. Different parts of the body, things changing and moving around. You might have a few weeks of body aches, and then you might have a few weeks of headaches, and a few weeks of real profound fatigue, and a few weeks of confusion. Or you'll have pain in the large joints, and then it'll switch to the small joints. And then you're going to a neurologist, then you're going to a bone doctor, then you're going to a stomach specialist, then you're going to a counselor. And they get labeled as being crazy.
Severe headaches.
Cognitive problems.
Fatigue, headaches.
Cardiac arrhythmias.
It hurts on my foot.
My knees, my back.
I'm tired. I hurt.
Involuntary movements.
Brain fog.
I lost the use of my right arm.
I became dyslexic.
I had hallucinations.
Blurred vision.
Light sensitivity.
It's a long laundry list.
You know, I look at these charts and I think of the people who've gone blind. They've lost their hearing. They are in wheelchairs. I mean, it's terrible. And especially because so many of them, it could have been prevented if they were properly treated in the beginning. That's what kills me. Man, it was such a waste. Look at all this. Such a waste of people's lives, of money, resources, time. And all it takes is knowledge. I bet you that if these people, all of them, had seen a Lyme literate doctor in the very beginning of their illness, I'm sure more than half, if not more than 3/4 of them, would never have gotten to that stage, ever.
If I had not been able to find doctors who would soak me in antibiotics for years, you wouldn't be talking to the guy that you're talking to right now. The folk myth is somehow that antibiotics are bad for you. I just have to say they're certainly not bad for you if you've got a fatal infection.
This disease, it's taken over my whole life.
It's been a horrible journey.
Every day driving home, I would think of driving a car off the road or something like that.
I said to my mom, you know, it would be okay with me if I didn't wake up this time.
I said, God, take me home tonight. It was not even a request, it was a demand.
What's gonna happen to me? What's gonna happen to me? I don't wanna die.
I am scared. I'm very sad because I don't know what to do.
I'm going downhill, gradually down, 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 down.
Are you able to stand up, honey? All right, I'm going to shut this off so we can take you back in the house, okay?
Good.
All the articles basically state that this really isn't that big of an epidemic and that it doesn't really do that much to your body, and that it's just a very easy, quick cure. A couple weeks of antibiotics and you're good to go. Obviously, those people haven't actually seen what it does.
There's no medicine for someone like you. You're an attractive girl, and obviously, you don't feel like you're getting enough attention. This is my adrenaline now.
She's become very, very good at hiding symptoms. It doesn't matter how bad she is. I mean, the girl cannot get out of bed, and her catchphrase is, "I'll do it myself."
I can do it myself.
That's right. I mean, she can do it. I can go grab something in 30 seconds, or she can take 4 hours to crawl across the house, and she will not let me go get it.
He said, we're gonna have to do 6 to 8 months of antibiotic therapy. We'll have to put a catheter in, to your superior vena cava, and then you're gonna probably get worse. So I said, well, by worse, do you mean like emergency room worse? And he said, yeah.
Okay, today is July 5th, and Mandy's having a little bit of an episode.
It's a feeling of being trapped within your own body. It's So it's like being wrapped up real tight like a mummy. So you can't move anything. And then having tape across your mouth. So you can't say anything. But reality is, you gotta kill them. You gotta kill the little bugs because they're taking over. Okay. What I'm doing right now is sitting in my wheelchair. Sean doesn't like to videotape it. So we've gotten a couple tips about that because I think it's important for other people to see this.
There are times when I feel like I need to get away. Not that I'm trying to run away from her, but that...
It's too much.
Sometimes I need to go and do the things that I used to do before this started just to feel like, okay, that life is still there. You know, I mean, just like her,
That feeling's there for me too, and I just can't.
I know.
We were told it was going to be a long road. That doesn't mean that I don't worry about it driving a wedge. It doesn't mean that I don't think that maybe at some point Sean might change his mind.
We were having dinner, just, you know, watching TV, and she started having a reaction. It was a mild seizure at first, and it progressively got worse. She was having a problem breathing, and then stopped breathing altogether. The first doctor that we met with, first statement was, Lyme doesn't do this, that's not what you have. Three of the doctors all asked if she's seeing a psychiatrist because they all just assumed it was in her head.
My body had been losing ability for a long time. Cognitive function, physical ability to do things, and I'd been keeping it down, you know, working around it, adjusting my life. So, you know what? I don't want to hear it. And I'm sorry, but I have been dealing with it, and now we have been dealing with it. That's 10 years. That's a long time to be patient.
I mean, it's frustrating to hear doctor after doctor after doctor say either A, Lyme doesn't exist, or Lyme doesn't do this, or, you know, well, what you're experiencing isn't Lyme. It's almost like they've been trained or programmed that this is what they're supposed to say.
Lyme disease is a significant disease we don't have a cure for. And that we don't have accurate testing. That should scare people. So how do you know if you have it? How do you know how to fix it? How do you know what to do? And by the time you're so disabled by the disease, you're in a panic state. You want help, it doesn't matter. You'll pay anything to get your health back. And the fact that doctors who are willing to help you and are legitimate doctors willing to put their license, their life on the line to help you, and that it even has to come to that, is scary.
Hey, sweet. How you doing?
Good, how are you?
You made significant progress. I'm delighted with the fact that your multiple neurologic symptoms are so much better, and that you have control of your body. You can live in your own skin. From someone who came unable to swallow and you know, altered bedridden, altered sense of smell and uncontrolled tremors and seizures and couldn't stand up, and gosh,
I'm looking good.
you're looking good.
Well, my greatest fear is that, you know, like some of the couples out there who have Lyme, that both of us will be impacted by it, and that he would have gotten it from me. You know, he's complained about a lot of aches and pains.
I'm not old, but I'm getting older, and there's things that I'm feeling that probably happen to everybody. Like one of my eyes right now, I gotta go to a vision guy because one of my eyes is blurred out, and I've always had 20/10 vision. I mean, all of a sudden this eye, and it was like an overnight thing that suddenly I'm having issues with blurry vision on one of my eyes, getting headaches, which I account towards the blurry vision. But bottom line is...
Mono-like symptoms. Goes horizontal, he's out.
Just feeling lethargic. I won't tell you that it's not in the back of my mind that it is possible.